Uko na bajeti kila mwaka, uko na bajeti kila mwaka 9 billion. Miaka 5 itakuwa ni bilioni 45 Murang'a County budget. Ongeza own source revenue na imeenda juu, na hapo tunaweza kukupongeza zaidi ya 1 billion own source revenue, about 1.2 billion kila mwaka. Sasa ni vizuri kusema uko na hii pesa na utueleze hii pesa kati ya hiyo miaka 5, katika hiyo miaka 5 ambayo tunamaliza next year August, ile kazi umemaliza, ile program uliweka na watu wanaweza kusema faida ni gani? What is the impact? A budget of 45 billion Kenya shillings in Murang'a, what impact can be seen? You will also tell us the HR management policy ya county. Does it include the ECDE teachers who are a critical component of education? Because ECDE pale chini ndio foundation ya elimu ya mtu kuanza elimu. So why are we seeing demonstrations from our ECDE teachers, and it has gone for too long? We have left it for you to resolve, but their cry and their constant demand that you look at their issues and request for permanent and pensionable with a governance approach. Because if I'm an ECDE teacher, I need job security. It doesn't make sense, because if I don't deliver or perform, inefficient teachers can be sorted out during review. At least you can have a system that weeds out, even if you are permanent and pensionable and you are not working, then you can leave service. But these are only about 1,500 teachers. It is time that the county government, under the leadership of our governor, dealt with that problem. Secondly, I think you also need to be able to tell Kenyans, particularly Murang'a residents, that the price of tea has improved, even as you criticize the national government. But also, may I request that you listen to this issue. Siasa kando, but it makes no sense for porridge for ECDE teachers, ECDE kids to be cooked away from the centers of their education. Why don't you engage the local community by way of employment of 1 or 2 people at the ECDE level at the center to cook porridge? Grow the local community, As you deal with smart cities, and it's a good program, why don't you first deal with the improvement of the roads that are actually left abandoned, which we are saying it's not maybe Maram. You need to look at the roads that don't have bitumen. We have several roads under the county government. It is time that we looked at that, so that as you are improving the cities, then the rural community can be able to access the towns, the local towns. Our health sector in this county requires absolute transformation, reform. We cannot continue having patients still sleep, share a bed. Adults who don't know each other, who are sick, sharing a bed in Maragua, level 4, in other level 4s within the county. They are still your patients, or our patients, our residents who are hospitalized. are still sharing beds. That is an emergency for me. Governor, it has, remember there is something we call integrity and dignity. I really think that we are stripping our patients' dignity to the lowest by continuing to leave them to share a bed. And I think some of the diseases obviously are infectious, so that is not the time to really share a bed. Commit a budget to completely remove some of those shameful conditions that the patients are still going through. Of course, medication and medical equipment, we still need to know how the Kang'ata Care card is operating. It is either universal, so that if I got it in Murang'a and I fall sick while in Nairobi, then it can be accepted. So don't let the people have a card that is not universal. Find a way of integrating Kang'ata Care with SHA so that they can benefit when they are not within the county facilities. And I think that is a minimum request, because you have said healthcare and education is one of your key programs.